Hello, good morning, everyone. My name is Laura Nunez, Dr. Nunez, and I'm a co-leader in this group. Very nice to see you all. We have a presenter today, Dr. Santos Avilés. She will be talking about alcohol use, right, and treatment. So yeah, I'll leave you guys with her so you can start as soon as you're ready.
All right, so let's start then. Okay, so yeah, I'm Dr. Kimberly Santos Avilés. I'm the Director of Medication-Assisted Treatment in Salud Family Health, which is a primary care in Colorado, integrated care clinic. So today we will be talking about working with Latinx population and substance use disorders. This is the objectives. You saw them in the email. So we were explaining common substance use disorder among Latinx population, the prevalence and treatment recommendations, the criteria, symptoms, and interventions adjusted for the population. Important to mention for the purpose of this presentation to increase inclusivity, I'm going to refer Latina, Latino community as Latinx. You will read that sometimes I write the Latinx, Latine, but I will just say Latinx, okay? All right, so a little bit of the background. There will be a lot of background there. So Latin Americans represent the second largest ethnic group in the United States, and it's growing. So they're expecting that for 2050, it will be around the 30% of the whole population. And it has been shown that the US population of Latinx is approximately 58 million right now, 18% of the total population. So 12.7% of the Latinx people 12 or older, which means like 6.2 million people had a substance use disorder. So just thinking about that. So when seeing this data, we are basically seeing after 12 that after 18 years old or older, the prevalence is higher, is about 13.5% of substance use disorder. So we are seeing a lot of people with the substance use or problematic use of substance. 94.8 were classified as needed treatment specifically for substance use, or a mental health center, inpatient, outpatient, but they didn't receive such specialty care. Substance use disorder, based on the research, is higher among Latinx people who, one, were born in the United States, live more years in the United States than more recent immigrants, use English more than they use Spanish. And also, substance use varies across heritage groups and location. So here, this is data from SAMHSA. I tried to look for 2022, but it was difficult. The last was 2020 and 2021. So this is basically, every year they do like these questionnaires or surveys to people who are living in the United States. Specifically, they characterize like Hispanic. So approximately like 70,000 people were interviewed for this survey. In 2020, because of the pandemic, they only interviewed 36,000 like complete interviews. But you can see here the data. Among Hispanic with substance use disorder, 4 in 9 people struggle with illicit drugs. And this also includes cannabis, because it's not like some state is legal like Colorado, but other state is not, so it's still considered to be an illicit drug. 3 in 4 Latinx population struggle with alcohol use, and 1 in 5 struggle with both illicit drugs and alcohol. So you can see here that means that 5.7 million people aged 18 or more have a substance use disorder. And so 7.7 million people 18 or more have a mental illness. So In general, when we put this together, 2.4 million people have both substance use and mental health history. So it's really, we can see that if we treat alcohol use disorder, there can be some trauma behind, some depression, some anxiety, and other mental health diagnoses. So let's talk a little bit more about Latinx population and the common substance use. We are going to talk about each one. So first, let's talk a little bit of alcohol use disorder. You will see this picture is basically, so for substance use, the criteria symptoms are basically the same. The only thing that changed is the substance. So alcohol, tobacco, cannabis, psychedelics, and other. So I will jump the picture, but for now it's like difficult to stop drinking more than intent, cause issues of work, with family, withdrawal symptoms, interfering with personal responsibility, loss of interest in hobbies, and all of that, and trouble with decreasing the consumption. But talking specifically about the problem in the Latinx community, at least 67.7% have one drink in their lifetime. And it can be after 12 years old. Some cultures, specifically, for example, Puerto Rico, they are like, when you explore the different traditions and value, people who are minor try alcohol beverage before the age of 18. And interestingly, like in almost all the data except tobacco, Puerto Rican were the highest number. What they found is that with Hispanic in general, not only Puerto Rican, but Cuban, Mexican American, and South America, studies have shown that adults who do drink tend to drink more heavy than people from the United States. So the rates of alcohol use among this population is 5.3%. And research show that drinking patterns among Latinx are different. Understanding these differences can help us to just create more preventative services, intervention, treatment program to better serve this community. About 24.7% of the Latinx report binge drinking in the past month. And this is something that is really important to consider because they not only drink more heavy, but they binge drinking in one sitting. So the consequences of the alcohol, as I mentioned at the beginning, it can include social problems, health complication, and compared to other Latinx American, Mexican American, Central, South American, they're most likely to be charged for drunk driving and have a DUI. Hispanic men have the highest rate of alcohol-related medication condition, which is like cirrhosis. So that's something important to explore. Latinx men progress from liver impairment to liver disease at higher rates than other communities. And as I was mentioned before, the binge drinking can lead to possible further issues, including the odds of dependence, motor vehicle accidents, problems with law, and all of that. So I'm going to just continue to talk a little bit about the different substance use, and at the end, because it's like the same criteria, I will show some statistics, but at the end, I will talk a little bit more about the intervention since they can be adapted for each substance. So this is for cannabis use disorder. Again, the criteria, like using for longer periods in large amounts, unable to cut down, excessive time spent acquiring, strong urge to use cannabis, problems at school, work, family, and withdrawal, opposite sensation, and others. In 2020, cannabis was the most commonly used drug. Guess what? The pandemic was there. So yeah, a lot of people started using cannabis more often. The percentage of past month of cannabis use was higher among Hispanic and Latinx young adults between 18 and 25 when they compared to younger or older, 26 and older. So it was between 18 and 25, and Puerto Ricans have the highest rate of recent cannabis use among the Hispanic or Latinx population, around 5.6, while Cubans in South America have the lowest, 2.1. Interestingly, according to the National Youth Risk of Behavior Surveillance System, 42.1 Hispanic youth have used cannabis at least once. So it's almost 50. So it's it has been like there is a lot of people exposed to what is cannabis, and specifically after the medical and recreational use. In addition, there is also an increase of vaping, specifically in adolescents. I know that I think the jewels were prohibited recently, but they still like having vaping that look like pen or e-cigarettes in school. And research found that 25.6% of Hispanic and Latinx population and students specifically report vaping marijuana or cannabis, compared to 19.4 of Black students and 18.2 of white students. So you guys can see that there is like more access and more use. For tobacco use disorder, the criterion is the same. So use in large amounts, unsuccessful efforts of cut down, excessive time spent using the drug, failure to fulfill roles. So in the Latinx community, adults who were born in the United States are more likely to smoke cigarettes than adults who live in the United States but were born in other countries and then moved. The prevalence of cigarette smoking has been higher among Puerto Rican, Cuban, than Mexican, Central, and South American. For the 2021, the tobacco survey for youth showed that 7.4 Latinx middle and high school students currently use any tobacco products, and this can be like chewing, vaping, smoking a cigarette, and 9.1 Hispanic high school students currently use any tobacco products compared to white students. So you can see there and Black students. 5.3 Hispanic middle school students currently use any tobacco products compared to white students and Black students. So I know there's a lot of percentage, this is still the background, but the important thing is like the prevalence use of vaping and e-cigarettes is high, mostly in Latinx adolescents than Latinx adults. The other substance opioid use disorder, this includes heroin, fentanyl, oxycodone, hydrocodone, codeine, and morphine. I found this, which is really interesting. It's like an acronym, which is helpful to understand the different criteria, because again, this applies for everything. The only thing that changes the substance. So cut down, so a persistent desire to cut it down, but failing, continue use, ongoing physical, psychological problem or health. Excessive use, taking in larger amount, withdrawals, and all of that. So in 2020, SAMHSA provided this statistic about opioids. So you can see there like 1 million people use a prescribed pain reliever and they misuse, right? So you can see there specifically hydrocodone, oxy, and fentanyl. Because remember that right now, we are seeing a lot of overdoses regarding fentanyl, but at some point it was used for pain, chronic pain specifically. But the problem, it's like the high addictive components and people like doing some mix and using as a recreational drug. So usually all the opioids are at some point used for medical as a prescribing for people who has cancer and have a lot of pain or chronic pain, like back pain. And then it's like people have access through other methods, not only like in the medical setting, but outside. But still, there was a lot of, at some point, there was a lot of pain prescription around without control. And this creates some dependence, and people were unaware what were the opioids at the beginning. So yeah, there's a lot of controversial in that side. So basically this increased the population, specifically in the Hispanic, people who are misusing this. So at least 3.7 of the population were misusing. In 2017, there was the National Public Health Emergency where more than 47,000 people were reported death from opioid overdose. In general, like according to SAMHSA, opioid use disorder from heroin and prescription opioid misuse rate among Hispanic, Latinx is similar to the national population rate, about 4%. And the CDC talk about the high school young adolescents have specifically highest prevalence of this drug use, which is about 16%. And this includes the prescription opioid misuse. They have access to prescription. So it's like 50% compared to the total high school youth population, which is 14 for everyone. So it's not like that different from other communities. So in 2018, the general Hispanic and Latinx 8th grader had the highest level of substance misuse across all substance compared to white and African American. So this raised this flag about what is happening with, since people are young, there are more increase, more access, what is happening there. And other drugs, polysubstance is really common. So if a person is having problem with what substance, this not necessarily means that they will use other, but it's common that they may have problem with other substances like cocaine, amphetamine, siloxane, which is an anesthesia, crack, psychedelics. And Hispanics specifically, they have the highest rate of recent cocaine use, 1.9 compared with the United States that you can see there is 1.7. Okay, enough of data. Let's just talk about this important thing. That was just a little bit of background so you guys can understand what is happening around. So what do we actually need to take in consideration when working with substance use in the Latinx community? So there's a lot of things to take in consideration. The first thing is acculturation. So this is basically the process incorporating the values, the belief, language, mannerism of the new country and their families living in, including behaviors that affect, for example, the health. It will be the food, the habits, the activity levels, and the substance use. So that's something that we need to take in consideration when working with this population. The gender, in Latinx community, women typically do not drink alcohol outside of small family gathering or private settings. But recently, there have been some controversy there, but that's what people usually see. And for Hispanic in the United States, this is basically changing. There's some research suggesting yes, some young Hispanic women are drinking as much or even more than Hispanic men, but still we need to take in consideration the attitudes and the stigma. So a lot of research suggests that Latinx community men, they have this relax and going with the flow while drinking or maybe socialize. It's more normalized, while those who feel this way, just to create more friends, peer pressure. So they have this style of, okay, drink alcohol, it should be normal because I'm a man. And there are other things that brings some other perspective, like the machismo, patriarchy, and all of those. And specifically, a lot of research talk about Puerto Ricans, where they normalize drinking, or specifically drinking alcohol, and now cannabis to be like, oh, let's just be relaxed. We have a stressful day, so let's just go and drink. Every Friday, it's social Friday, so let's just go to a bar and drink with people. If not, it's like, oh, you're out, you're not part of this group, you're boring. So there's a lot of attitudes attached to when you drink and when you not. So that's what I refer about attitudes and stigma. Job, if the person is currently working, the income that they're receiving from the job, the mental health, as I mentioned before, the substance use usually, not every time, but usually brings also mental health disorders. The family, what is happening in the family, if there's any stress about family, any support, what is happening there. Another thing to take in consideration is the preference in beverage. So for example, in Puerto Rico and in Mexico, the majority of Latinx community, they prefer beer and then they prefer wine. Usually the statistic mentioned that women prefer wine while men prefer beer. And they don't only like drink one, but they drink a 6-pack or in one sitting. And also another thing to take in consideration is the lack of insurance. So there's a different type of barriers to treatment for the Latinx community. One of them is the language. So many people find that they can only access care provided by English-speaking clinicians. This might not be an issue for a bilingual person, but still it can be an obstacle for people who speak Spanish and express their emotion better in their first language or native language, right? And not only that, but also people who prefer to talk in their dialect. So this is a barrier, definitely. Legal, and so there is fear, and I will be talking a little bit more about it in a few minutes, but there is a lot of fear about legal if they're here in the United States. Is the stress about I'm not going to talk with anybody because they will report me, and yeah, I will not be receiving any treatment. Financial, so the cost of substance recovery obviously is a natural concern because they tend to be like not covered. Usually they're covered by Medicaid, but people think I know they're not covered by any insurance. I need to pay out of pocket. I don't have the money. So people just like, it can be a huge impediment for them to receive the care. And we know that Latinx and Hispanics have the highest rate of uninsured individuals compared to other racial groups. So definitely this is something that can play a role in a barrier. Stigma is one of the major obstacles to receiving addiction or substance recovery care for people across any race, any ethnicity. So people usually worry about what their family will think, friends will think about this, colleagues, the job, and all of that. And even after they recognize that they need help, they feel like they're going to be judged, not only by people around them, but also by the therapists, the providers, right? So that's another huge barrier that we have. Based on this, the research suggests that only 20% of Latinx community receive mental health, and this because they bring it up to their primary care provider. And the primary care provider create this warm handoff to talk with BH. There's still a lot of stigma. And stigma is attached of lack of information, right? Because if you don't have enough information, you will follow and trust what people saying outside. So, so this is another huge barrier for Latinx community, specifically because they are unaware of what type of help they have. So limited research show that treatment can help Latinx in general. Specifically, this research suggests who speak English, who are highly acculturated to United States life. But in the reality is that therapy can be helpful for everyone. Something interesting in this research is that people with severe alcohol problem in Latinx community are less likely to seek the treatment they need and less likely to join Alcoholics Anonymous, even though these are available for them. So we can assume that there's a lot of stigma, lack of information about it, and all of these barriers are part of this lack of access for them. So what to consider and explore when a patient arrives or a person arrives to receive treatment. So one of the first thing and most important thing is that we should be cultural sensitive about the way that we are going to provide the treatment. And it's really important, as I was mentioned before, they tend to express their emotion in their native language. And I think that's really important because receiving a treatment in their own language, it can be Spanish or any dialect, or including even a translator, is going to be helpful for them and really important in this type of services. Talking about familismo. So familismo is basically the cultural value involves dedication, commitment, loyalty to family. So involve this in treatment will be very helpful, specifically because it also involves like seeking the family advice for important decisions. They tend to do that. So involving the family is really important. So in addition to this, finding bilingual recovery programs that involve the family members can increase the likelihood of Latinx engagement in treatment. So definitely family should be included in treatment and recovery, because at the end, family is, they're often like this part of the person's home environment and daily social circle, and they value the family. So this is something that we should always include here and explore. Substance treatment programs may be optimal when they're gender specific and cater specifically for Latinx population. They're tailored for this population. Another thing is recognizing the importance of spiritual, religion, and faith in this community. Many Latinx, not everyone, but many of them value their religion. So around 82% of Latinx people identify with a religion. So in this case, it's really important to talk about this, explore this with people. This will help to create more effective engagement. And you can discuss preventative treatment and recovery based on this. Immigration, this is another factor that we need to take in consideration. So the circumstance related to poverty, economic insecurity, natural disasters, civil wars, living in the US can also influence substance use disorder and other mental health disorders because of the trauma and stress that they're going through. Discrimination and trauma. So there has been a lot of studies indicating the high risk linked to substance use disorder and all of these emotions associated with discrimination and the trauma of moving or trauma of their own home, natural disaster, all of that. And heterogeneity of Latinx community. So one of the things that happens frequently is that if you meet someone, they usually say, hey, are you from Mexico? So they're basically generalizing everyone there from the same place. So we need to be more aware where, like, what is the ethnic, what is the race, the patient is from where exactly, like, because if not, it will be a big problem. And we are overlooking like the existing diversity in the community instead of identify like, okay, this person is Mexican, this person is Puerto Rican, Cuban, from El Salvador, you know, so making sure that we are aware of this. And another thing to take in consideration is the risk for youth. So I know that I mentioned a lot of statistics over there. At the end, we can say like this, right now, this is starting from adolescent and youth. So there's a lot of Latinx youth that are just like experimenting with substance, and they are unaware of the risk. So that means that we need to start educating people from middle school, because you guys remember that I talk a lot about middle school, 8th graders and all of that. So we need to start providing more information about this since they're younger, specifically about the risk of opioid use disorder with prescription. And another thing that we need to take in consideration is during adolescence, they have a higher risk of doing high-risk behaviors because of the situation of their personal fable, that they think they're invincible, they can do whatever they want. So it's important to talk and educate them about this. Another important thing, stigma, misperceptions, and negative narratives. So many Latinx families stigmatize people who have an opioid use disorder, alcohol use disorder, or any type of substance use disorder, and they see it as a moral failing and not like a chronic disease. So they say like, no, this is their fault because they're under the control, and they're supposed to not like fall in this. So there's a lot of stigma there. And also a lot of Latinx are unaware of the treatment options, such as medication-assisted treatment or alcohol use treatment. So there is a lot of things associated with the lack of information, the misperception, and these negative narratives that they hear and they repeat. And we need to just like break or stop that all of those misperceptions. Another important thing associated with this is the fear and the tendency to take care of things yourself. So a lot of people hide the substance use disorder in the Latinx community within the family because they're ashamed, they feel guilty. And the statistic mentioned that only 5% of the Latinx with substance use disorder report the need for treatment, but not necessarily go to receive the treatment. So this is something that is important to talk with these people, and also the experience with law enforcement as well, because it can be traumatic. They have heard people or family member that they go through the same thing, and they are afraid of being in jail or prison or the court. And the tendency of take care of things yourself. So there is a tendency in Latinx community that you need to take control of your things, and it's associated with the moral failing thought, like I fail, I need to take care of this myself instead of asking for help. So that's another thing to be aware and take in consideration. So interventions. It is recommended to have a comprehensive and holistic approach. And these interventions sounds general, but remember that you guys need to take in consideration all the things that we talk already. So we are going to incorporate those things in the intervention. So for example, the comprehensive and holistic approach, we are going to involve the family here. If it is a value that is important for this person, we are going to address multiple factors associated with substance, and not only like the substance per se, but also the housing, the health, and job, everything that is associated and that is around in the microsystem and mesosystem and all of that. And a statistic mentioned that involving the family in the treatment, it can be helpful specifically for substance use. In addition to that, a lot of psychoeducation provide information about substance use disorder and the medications available, such as, for example, opioid use disorder, we provide buprenorphine, methadone, there is available. For alcohol use disorder, there's naltrexone or Vivitrol, disulfiram, which is an anti-abuse, and composite. For tobacco use, there is nicotine replacement like Chantix, patch, gum, and medication like bupropion. Understanding their values and traditions, so that's really important. I like having this therapy tailored specifically for this person can help a lot based on their values and the tradition, where they come from. And at the same time, we are working with the engagement in therapy and working with the report. This is some other interventions. So there is SBIRT, which is the annual screen, and I will show you what is it, but it's basically a small screening for substance use. So for example, audit is for alcohol screen, that's just screen, and I put some screenshots, but they're available in the internet, and I put some resources as well. And other brief intervention like motivational interview, CBT, behavioral therapy, brief therapy, family therapy. The important thing is that you tailor this, again, based on the person. Maybe you will need to making sure to involve the family and do more like a systemic treatment, a motivational interview, taking in consideration what we talked in the past, CBT specifically, to work first like this fear and then continue. Like you need to involve a lot of the things that I already discussed. Working and involvement in the community, so provide information about what is Alcoholics Anonymous, Narcotics Anonymous, peer support around for Spanish speaking. Always look for resources around. And contingency management, this is something that it has been recently, like there's a lot of places providing this. This is basically like a motivational incentive. The therapy provide incentives or prize to encourage people to not using substance use. And usually the goal in contingency management is to motivate persons that want to change their life, receiving like a gift card, money, a small amount. So this is something that a lot of people are talking about, and it has been like effective. This is other interventions to take in consideration and involved in the treatment. So access point for naloxone in bodegas, farmacias, community program, family support, naloxone communication for Spanish speaking regions. This is basically the Narcan, so they can have it accessible. Provide clarity of the Good Samaritan law and the limitation of the law enforcement and all of that. So remember that the Good Samaritan law, it's basically this legal protection to people who give assistance or support to those who are injured or overdosing and all of that. So educate about it, because there's still like a lack of information around. So it is important to always educate about this. Nurture support for Latinx families affected by substance use. There's still like, there are many programs that provide these services without any cost. So make sure to be aware of the resources around. Expand the knowledge of medication treatment, the access in urgent care, community health center, pharmacy, jails, and everywhere. Safe supply and use intervention with family, healthcare providers. This is basically a harm reduction approach where they, for example, can test their drug to see if it has fentanyl, using the fentanyl strips, just to making sure that if they're taking any drugs, does not have anything else, because this could lead to an overdose, for example. So more like a harm reduction. So every state have different projects associated with this. So be aware of this, give this information to people. And important, improve cultural competency among providers, mental health, substance use treatment providers, support staff, anyone. So it's always good to, I don't know, maybe sit down, have a talk in a meeting or something, to making sure that everyone is aware of all of this barriers, things to take in consideration, and at the same time working to reduce the stigma among people that are working with substance use. This is basically the SBIRT. This is just an annual screening. It's short. It's in English and Spanish. So I put both, and there's the link. And important thing, I always like to discuss with people like, hey, you're drinking, so let's just measure how much you're drinking and explain with drawings. I'm very visual, so I like this to explain how much alcohol, for example, they're taking. And this is some other examples of the audit in Spanish for alcohol. So there are more questions. This is the short version, but there is another version. And the DAST, which is for drugs. And it's basically, have you used drugs that are not required for medical reason? Have you used more than one drug? So it's basically like helping to structure those questions and making sure that you're asking the right questions. And this is basically some other resources available in general in the United States, like therapy for Latinx, Spanish language resources, a project from SAMHSA for underage for alcohol, which is Hablen, Ellos Escuchan, and other partnership to an addiction. And that is everything. Let me see if I can. So can I close this? I don't see a posture. There it is. All right, I don't hear anything, so if someone can say any questions. It's a lot of information, so any specific questions about any substance?
I have a question. Well, first off, just thank you for the presentation. I think, coming into primary care, I didn't have a lot of experience with substance use treatment, but I've just seen it so prevalent in the last year that I've been here. And so always looking for opportunities to see how I can improve, those clinical skills, but also from the provider side, we don't have great referral networks for MAT programs in Spanish. I'm in Missouri. And so there's just not a lot of options, especially because our population is all folks that are uninsured. And so I guess, would you recommend having those kinds of drugs prescribed in a primary care setting? And what would be maybe the trepidation with that if providers feel comfortable?
Yeah. So yes, definitely yes. Here at Salud, we are a primary care setting. We offer MAT and we offer also Vivitrol. So for now, they will need to take some certification and a waiver. But the important thing, on June 23, the president delete the X waiver, so everyone can provide, for example, buprenorphine or Suboxone, which is MAT. So there will be more access. And I highly recommend primary cares to start maybe reading or having the basic education. There will be a training really basic for everyone after June. Because the thing is, if you think about this community specifically, their go-to is always the primary care. That's the first option. Some of them, yes, they go to the emergency, but at the end, they need to come to the primary care for, wellness check for the kid or their own health. So it's really important to have those services available there, because remember that they trust these people that are seeing the kids every time, they're seeing me every time. So they trust that, and they will trust them to provide the services and explain better, all that involve MAT and Vivitrol and all of this. So the answer is yes, and hopefully they're open because this is sadly, for example, for opioid use disorder, we are seeing a huge increase in the United States of overdoses and using specifically with fentanyl and the new drug, which is called Frankenstein. I forgot the real name. I always forgot that one. But the thing is that it's really powerful. They're combining more drugs. So having more access, it's fantastic. So yeah, maybe sit down, gave them a basic presentation and educate them. So, and explore if they're open to that at the end. It will be very helpful for the clinics and for the population.
Thank you. Thank you. And you said that is a nationwide policy that's going into effect in June?
Yeah, June 23 of
wow.
this year. Every
Wow.
every provider, PA, nurse, and doctors can provide Suboxone specifically or buprenorphine.
Awesome. Thank you.
Of course. Any other questions? Something that you guys want to clarify? I know that I mentioned a lot of stats. I was like, okay. Well, if not, I think this will be.
Yeah, any other comments, questions? Not at all.
I believe that this presentation will be available, right? Because I
Yeah,
put
there's
a lot of links. They're really helpful. So yeah, I hope that you guys have access to this.
I think it can be shared, or the recording is going to be shared. I'm not sure the presentation itself, but
Okay,
yeah.
I will send you the presentation, or just in case.
Well, thank you, Dr. Santos, for the information. We will be meeting next month as well, so you will be receiving some information about our next meeting. So you should be waiting for that, or just attentive. I don't know what the word would be to that, and whenever it comes out. Yeah, I don't know if Jackie wanted to say something, or.
Me? No, sorry.
No,
I'm
no.
just reading
Okay.
today.
You came
Everybody
up
else
and
is
I was
asking
scared. I
questions,
thought
but I
maybe
don't
she
know.
wants to say something about the presentation, like if
one.
it's gonna be shared or not.
No,
Okay.
no. And the recording, we'll get that
Yeah.
posted too. It's great information. So
Mhm.
Thank you. Thank you,
Great.
everyone, for being here. And yeah, I hope that this is useful. If you have any other questions, feel free to reach out. And there are some comments that I cannot see.
They have a question in the chat. If we have a listserv to share information, we see if it does.
yes,
You would have to join, right?
Yeah, members have to post something on that. You can also post on our website. We have a career center. And if you're a member, you can post on that for free. And otherwise you would, there's a cost to post, but you can post on there also.
Okay. Good.
All right.
Great. So have a good evening, good afternoon, everyone. See you in our next meetings.
Thank you very
Thanks.
much,
Bye-bye.
everyone.
Thank you. Bye-bye.
Bye.